Welcome to Transforming Relationships. I'm your co-host, Dr. Eric Spiegel. Here with me, as always, is my co-host, Dr. David Alter. We're so happy that you could be with us here today. And today we have a special guest, Dr. Carolyn Daitch, a psychologist, a best-selling author, and an expert on the treatment of anxiety disorders, and particularly the treatment of anxiety disorders using clinical hypnosis. Carolyn is the author of many books, but there are a couple that we want to really highlight for today's conversation. Those are Anxious in Love, which is a wonderful book about how anxiety plays out in relationships with couples. The Road to Calm Workbook, which is a really great book with practical suggestions for clients on how to manage their anxiety. And last but definitely not least, and I say this because David and I really hold this book dear in our hearts, The Affect Regulation Toolbox, which is one of these versatile books that can be used both by clinicians and clients alike. But what's really fantastic about this book is that it distills what, until Carolyn had written this book, were more complicated hypnosis techniques. And it really breaks them down into kind of manageable, tiered techniques that can be used in treatment. And I know it's a book that I've referenced greatly over the years. So we're so excited to have Carolyn join us today. And the last thing I'll say before turning it over to both of you is that this is a moment more than ever that calls for Carolyn's expertise, because not only are we going to be talking about anxiety in individuals and couples, but we're going to be talking about the anxiety of the moment, the fear and anxiety that pervades our society, and what we can do about it. So welcome to the show, Carolyn.
I'm delighted to be here. And as you know, I'm fond of both of you, so it's a particular pleasure to be joining you with this podcast.
It's so good to see you as well. I'm always excited to connect with you. I don't see you often enough. I suppose teasingly I can say if I don't see you often enough, I start to get anxious.
Well, do I have some tools for you, David?
That's great. So maybe as a way of entering into our conversation, most of us have known for a long time that anxiety is probably the number one mental health challenge that people experience. What makes anxiety sort of the go-to reaction for so many people? What accounts for that, Carolyn?
Well, first of all, we're wired to have anxiety. We wouldn't have survived without anxiety. It would have been pretty bad, as they say, to have mistaken a stick for a snake than the other way around. So we survive by being a bit afraid, and we survive by having negative thoughts. So that's wired in us. But then what happens is that we're living in the age of anxiety. I was thinking about that German word, I hope I'm pronouncing it correctly, Zeitgeist, which means the spirit of the time. This is like no time that I've ever lived in before, where there is economic instability. Our young people don't know how they're going to buy homes. There's world crises that we read about every day. There is also a lack of communal structure. We used to live with people who make us feel protected, and that has gone away in general. And then we have this constant stimulation from that we hear all the time, dinging, getting our attention. So it's not only a personal issue, but it's a communal issue now. And if you happen to be unlucky enough to be born with a tendency toward anxiety, which many of us are, it's not our fault, it's just how we are wired. But then we live in the world of anxiety. It's a perfect storm for suffering.
Yeah. I really like the way you're emphasizing this multi-layered set of factors that are all coming together to produce, as you described it, the zeitgeist, the nature, the spirit of our times. That's unstable and uncertain, and our hardwired reaction to that is to feel at least nervous and a little on edge, and then it can go out from there to more extreme levels of different forms of anxiety disorders. Do I have that
Right. You've got that
accurate?
right. During
Okay.
the pandemic, for example, I had many people who I'd finished therapy with 10 years previously who came back
Hmm.
doing fine.
Okay.
But then the fear of what was going to happen to their bodies made them in a very anxious state where they couldn't handle it anymore.
And I also wonder, if there's something very apt for our times in the metaphor that you gave, Carolyn. You talked about anxiety being our evolutionary hardwiring to be able to differentiate between the stick and the snake. But it seems like with the rise of social media, AI, algorithms, disinformation, people and groups that are incentivized to really blur the distinction between what's real and what's not. Maybe part of what's happening in this moment is, as a society, we seem to have lost some of our resilience in differentiating between the stick and the snake. Can you
Well,
speak to that?
you're making a good point, and it's also making our work harder, at least
Hmm.
my work harder. A theme in my work with people with anxiety is that they tend to catastrophize. They overestimate the likelihood of bad things happening. And so it's been relatively easy for me as a clinician to bring it back. These are possibilities, not probabilities. The other thing that people with anxiety forget is that most everything is transient. So we're worried about an exam today, but it'll be over. Unfortunately, with what is going on right now, those tools that I use frequently are not applicable because some things could be catastrophic, and if not catastrophic, difficult. And when it comes to transient phenomenon, it may take a long time for us to be on even plane. So when my clients, a certain percentage of them, I don't know about you, Eric, but a certain percentage of my clients talk about these themes in addition to their personal themes. And I can't use those tools. I can
Hmm.
only validate that I know how afraid they are. I know how powerless they feel. So it's a different time, not only of our lives, but a different time of therapy as well.
Hmm. Hmm. Okay.
Does that validation help? Can you speak to that?
Yes. Good question, Eric. Yes. When we're sad and we're anxious, we want attunement. We want attunement from the moment we're born. And there's something about having somebody hear you and say, yeah, I know it's scary. I know how hard it is for you not to be able to pay all your bills. I know how hard it is for you to worry about climate change because indeed, I might be offending some of your audience here, but I'll take a risk. There's something true about climate change. So when they hear from me, I run a couple groups, women's groups and mentoring groups, and when they hear from the others that they are not alone in their fear, there's something very comforting about that. Yeah, I get it. I get it.
So I'd love to pick up on that point. We've talked so far about some of the realities of the times that are activating what we're hardwired with, right? So people are not just nervous, they're anxious, maybe even panicking. And then you said, and they often, that panic, that anxiety leads them to feel alone and isolated. The tools you have used right now aren't as effective sometimes as just being able to validate. The podcast Eric and I have is about the central value of connection and relationship.
Hmm.
So, can you talk a little bit about how, if all of us are hardwired for anxiety, what through history and especially now, what is the counterpoint? What helps us to contain that anxiety, channel that energy perhaps in better directions? So, as Eric said, we can access our resilience, not just our fears. Can you speak to that a little bit?
Yeah, I can. And I will just add on to that. Not all of us are wired to have anxiety disorders.
Mm-hmm.
All of us worry, but some people don't suffer so much with worrying. And those who suffer more with worry generally have a genetic propensity for worry. I've almost never had a client with anxiety where mom or dad or grandma or great uncle George didn't have anxiety. So some of us have that tendency, and that exacerbates everything.
Mm-hmm.
So I wanted to say that. And then in terms of what are they? Are you asking me what we should do about it? Is that what you're asking? Can you repeat your question again?
Well, sure. I think I'm struck and very much agree with whatever capacity, whether genetic or just a tendency to be nervous and fearful, to identify what's out there that could be threatening. But we've survived a long
Yes,
time. So
right.
there's some sort of other side of that coin that I suspect we also have. And I'm wondering what your sense is of what is the other side of that coin that helps us show our resilience, right? And is that in part our capacity as social creatures to be calmed, to be comforted by our connection to others, the way you can say to a person, I get it, you're not alone, I see you, I hear you, I know where you're coming from, and the effect of that on them. So, what is the other side of the anxious coin that's helpful? And is it a social other side?
There is a social other side. However, right now, those possible potential other sides can be quite polarized, David.
Hmm. Hmm.
Yeah,
Yes.
and I was even struck when you were talking about that the example you gave of climate change, right? So um, maybe you're somebody who uh, doesn't believe that climate change is real, and if there was ever going to be an opportunity for you to lean forward with openness to somebody who does believe that, and not only believes that, but is quite concerned about that, I would imagine that you would really need to feel like there are people who understand you, might share your skepticism, might share your sense of disbelief, might share your sense that maybe that shouldn't be the number one priority. So I think to David's point, perhaps we need to feel the attunement first before we can allow ourselves to be open to different views. Can you speak to your experience with that?
Yeah, I'm really glad you're asking that question, Eric. Um, I'm seeing real polarization in families, even in marriages.
Mm-hmm.
And so, what people need to do, and this is very hard, is to first connect with attunement, connect with care, connect with appreciation. I have a technique that you may have read about it. It's called juxtaposition of two thoughts and feelings. And what that means is that I'll use you as an example, Eric. Okay. Um, let's say there's ways in which you and your wife, your lovely wife, don't agree or
Well,
irritate you.
that never happens though.
I'm sure it doesn't happen. I'm sure it doesn't happen with you, Eric, because I've known you a long time and I know you're perfect and you can
She would
solve.
disagree.
That's good.
And so what you first need to do is calm. I think you always first need to calm, because our reactivity, our anger, our terror is mitigated when we're calm. And when you're calm, Eric, I'm not seeing you right now. What you could do is, on one hand, I literally do it physically, and David, you can do it too. On one hand, you can put anything that is irritating to you about your partner or even your children, and put all that in that hand, and it's there. And you have to acknowledge it mindfully and respectfully and not pretend it's not there. And put the tension in your body there, and the anger, the frustration, or the thought that she's wrong, and put it in one hand. And then take your fingers and make a fist. Make a fist. And then in the other hand, and I've met both of your wives, and I know there's endearing qualities to them, I want you to think about everything that is endearing about her. What is precious about her? What is intrinsically lovable about her? How helpful she can be, how funny. And put those qualities in the other hand with the open fingers and make a fist. And now you have two fists, and you bring them together. Can you see me?
Yes.
Mm-hmm.
And you bring them together, and then you open the fingers up and clasp them together and bring them down to your heart with one hand, the loving hand above the other hand, and just acknowledge that you can love somebody and be irritated by somebody. You can have both sense of thoughts and feelings and emotions be together. And any of you listening out there, when you're annoyed with somebody or talking to somebody who's politically so far away from you, and this is getting to be a big, big challenge now. If you like this person, you can connect, that you do appreciate that they're smart, or they're generous, they're funny. And then connect to the parts that are bothersome to you. And you can do it in either order, and then hold them to your heart. And what the point of it is that we can be connected and differentiated. That's the thesis in part in the Anxious in Love book that you so kindly mentioned, is that we can be different and not alone.
I hope nobody was listening to that segment while driving a car, because I'm feeling pretty calm right now. Yeah.
And so that would be something. It's harder than it's ever been, but it is possible. It is possible to connect to what is endearing about another person or what you admire about another person, even though you're totally different in your perspectives about politics and life. And we need that practice more than ever. And we need it. I know I need it with my clients. I don't know about you, but if I have a client who thinks very differently than I do, I first start with breathing and moving into a feeling of love for them, and that person is precious. And I can connect to them and find them precious, even though I really believe they're wrong. I truly believe they're wrong. And I think it's a challenge for us clients, us therapists, to be doing that now.
I would love to pick up on that. That was really as Eric said, just so beautiful, Carolyn. It captures, I think, the essence of the work that you've done and what has made you such an expert in this area of how we work with anxiety and fear. The particular point that I was struck by is that earlier you talked about us being in polarizing times, right? And I make a distinction with my clients between polarities and polarizing, right? So
Ah,
me and my spouse may differ. We may have polar positions
uh-huh.
on a particular issue. I think it's good. She thinks it's bad. She thinks it's good. I think it's bad. So it's okay for there to be polar positions. But as I understand it, part of what we're dealing with in these times is not just polar positions. Yeah, there are lots of people who have different views, polarizing positions, in which case the other is not legitimate. And I'm wondering, when you get a client who's in that polarized positions, rigid, attached to that, how do you engage to bring someone back to a position where they can see difference, sense difference, recognize difference, and still have care and love for that person?
Well, that's a really, really interesting question and challenge. I've had a lot of training in imago relationship therapy. I just actually came from their international meeting. And the technique that really works is simply first to listen. So, David, you're saying such and such. And use the right same words. Because again, from the start of our lives, we want to be given attention to. That's what we all yearn for, is attention. So we repeat the words, and then you can say, from not your own perspective, but I was talking to you, David, from your perspective, to say, David, it makes all the sense in the world that you think that. It makes all the sense. I used to use the ones with, I'm not a gun person. But certainly it hasn't been difficult for me over the years to say to clients who like guns and who like to hunt that it makes all the sense in the world that you love hunting. You love being out in nature. You did it with your dad, and it was such a bonding thing. And it is true that we live in a dangerous world and you want to protect your family. So it really makes sense that you believe that we should all be able to have guns and not even necessary and take them. You as a teacher, it makes sense that you want to protect your children. That could be so far afield from what I think. So it's not that you make sense because of what I think. You make sense because of everything I know about you. And then you go into empathy. And the empathy is you, if you don't have a gun available in your house to protect your family, I imagine you would feel really vulnerable, scared, and even irresponsible. Did I get that right? Empathy is just a guessing. And somebody said, yeah, I feel those things, but I would also feel disempowered. So if you mirror and validate and empathize, you, as in the connection, you do not, there's not that schism, even if you think entirely differently.
And you know, we as psychologists like to throw out terms like mirror, validate, empathize, attunement, but what you just did there really brought it home, right? Because where you went is not necessarily the label of gun owner, which people are going to project whatever they're going to project onto it, but the experiences that underlie that identity,
Right.
which are universal, right? You talked about maybe you did this with a parent growing up. Well, everyone can relate to having
Right.
experiences like that, or a lot of people can,
Mm-hmm.
right? Or maybe, it's your wish to protect your family. Again, that's something that most people can relate to. And so, when you're speaking like that, it really just becomes easier to find that common ground. So I
Right.
just wanted to just highlight what you were doing there
Mm-hmm.
for our listeners and viewers.
Mm-hmm. Rather than hearing you're wrong.
Hmm.
Do you know my school children are killed almost every day, rather than going there to get into their world, even if it's entirely different than how you think. I want to talk a little bit about something that I've learned over the years, and that is the value of having anxiety.
Mm.
When I was a little girl, I used to go to my Aunt Gladys's house to stay with my cousin Marina, and Aunt Gladys was very, very anxious. She was her. And I'd come home to my family and think, oh gosh, I'm so lucky my parents aren't anxious. Indeed, looking back, they were under anxious. They were not sufficiently risk aversive. But over the years, working with anxious people, I learned to admire them, learn that I could learn from them, that anxiety is not all bad. It's a two-sided coin. Um, my clients who are anxious are very careful about making decisions. So they're less apt to make mistakes. They're prepared for every eventuality. I'm just moved my home uh, from Michigan down to Florida, and I realized there's some things I forgot. My anxious clients wouldn't have forgotten anything because they would have checked and rechecked it with if they'd taken everything.
Yeah.
They're prepared for every eventuality. Although their children suffer because they model anxiety, they're certainly signed up for the Boy Scout group quickly enough or the summer camps. They don't drop balls. And so caution, carefulness, even vigilance can be really valuable qualities, but there's a cost. There's a cost. If we walk around with anxiety, then we we suffer, we miss the pleasure of the current moment. We hurt our relationships, something we may or may not have time to talk about. So anxiety can be motivating or it can be crippling. So we want to be appropriately risk averse, but we don't want to be a prisoner of our anxiety. We don't want to be a prisoner of our anxiety. There's a recording I did on MP3 called Dialing Down Anxiety. And what the thesis of that is you, on a conscious level, think, how anxious should I be about this event? And people who with anxiety have an incongruity between the stimulus and the response. Like, for example, on this podcast, if I was at a 9 on a scale of 1 to 10, it would be incongruent. It shouldn't have been that. If it was a 0, I might have slept through this event or not thought about it at all. So we need to dial it down so that the stimuli is congruent with the reaction. And most of my people need to dial it down. You can see my fingers. I'm not seeing me. Literally using your fingers to dial it down. And sometimes it should be all the way up to a 6. The medical students who shadow me need to be at a 6 to get through organic chemistry. They shouldn't be at a 3.
Yes.
Personally, I need to dial it up. I'll have some physical symptoms, and I'll dial it up and say, Carolyn, you've had this for 3 weeks, go to a doctor. So we need to be in the right spot for that. But it's not bad. It's not bad at all. I just had a client who had shoulder surgery, and she prepared for every contingency, including having somebody come to the house. And she thought of everything. And then she said to the surgeon, if I was any more prepared for this surgery, I'd be doing it myself.
Right.
So she's a little bit too much, but it does work for her. Absolutely.
What really strikes me about what I just heard is, first of all, that anxiety itself is not always and in every situation bad. And
Hmm.
you've made this point several times that actually we wouldn't have survived without it.
Right.
But the other piece that I hear that I think bears repeating is you talked about anxiety, worry as something that can be dialed up or dialed down in relation to the situation that you're in. So the problem isn't the anxiety itself, as I hear you describe it, but it's when you can't have that flexibility, that capacity to dial up, dial down as needed, either on your own or in consultation with your therapist or with other people in your social community who can be that counterpoint to help you access flexibility of that feeling. It's when it's inflexible that you're in trouble. Is that what I'm hearing?
You're hearing exactly right, but you're getting into another point that I make in Anxious in Love. Um, One, if you have an anxious partner, you should never start with, you have no reason to be worried,
Mhm, mhm,
because that breaks the attunement.
mhm,
And that's where, excuse me for being a little gender biased, men are more likely to do that.
mhm.
I can't believe that you're worried about giving this presentation. You've given hundreds of presentations. That doesn't make any sense at all.
Mhm.
But it's better to say, yeah, it makes sense. Every presentation is different. It makes sense that you want to do a good job. And I get it that you're worried. And would you be willing to listen to my perspective about it? So you start with attunement. You start with where they are. You do not start with reason. Or that person you're talking to will say, he just doesn't get me. In fact, I feel ashamed.
Yeah.
And then what happens with the shame is there's a withdrawal.
Mhm.
There's a withdrawal then in the relationship. So a 2 minute is part of dealing with this as well. And so we do need other people, but we need to train the people in our lives how to uh, connect to us so
Yes.
they get us.
What I heard, and I'll be brief, Eric, I think you wanted to jump in too. What I heard in addition to attunement is something that Eric and I have talked about related to the field of hypnosis, and that is the principle of utilization. Start with
Right.
where they are,
Start with
because
where
when
they are.
people feel seen, feels heard, feels
Right.
validated, they're less defensive, and then more receptive to what you may say with the kind of
Right.
care and attention you're describing.
Right. Right. And I'm glad you're bringing up hypnosis. We're all passionate about hypnosis. Hypnosis is really quite wonderful in treating anxiety. First of all, as we all know, hypnosis downregulates the system. Simply in focusing attention and getting into the now and breathing and relaxing the muscles, we move into calm. And when we move into calm, then we have you mentioned the word flexibility or lack of flexibility, I think, David. When
Mhm.
we move into calm, we're more flexible. We're more open to listening to your wise counsel and my own wise counsel. So hypnosis not only calms us, but affords us a diminishment of rigidity. And what is the characteristic of most people with anxiety? Rigidity. Rigidity. Inability to see it a different way.
And Carolyn, I'm so glad that you began to kind of bring in more explicitly how hypnosis can be helpful here,
Right.
because I was trying to put myself in the shoes of an anxious person listening to the show. And one area I could have imagined someone having a quibble was when you talked about consciously turning down the dial. Because I
Right.
think a lot of people would say, well, if it was that simple, I would have done it. So, what is it about the process of hypnosis that allows the subconscious and conscious parts of the mind to work together so well in this endeavor? Can you speak to it in this example you provided?
Yeah, yeah. It's in that state, and the theory is not only not only obviously do we relax in hypnosis, but the theory is that we can reach parts of the brain that may not be as accessible in a waking state. I use cognitive therapy all the time, integrated with hypnosis, but I strongly believe, and I think the research supports me, that it's much more effective if you're in that altered state. There's a shift there. And the other thing that hypnosis blends very well with is mindfulness, actually. It blends with the concept of mindfulness so that you can observe something that's going on, but with more detachment and less fusion. So in a hypnotic state, you can easily and beautifully combine mindfulness. And I just was doing that in my group yesterday where somebody was hurting a lot and she was able to be mindful of her sensation, but view it with curiosity and a little bit of detachment. The other thing that hypnosis does, sort of paradoxically, because in hypnosis we want to narrow attention, on the other hand, we can broaden attention. So I had this particular woman move her attention off of her back onto her left toe and then go back and forth. So again, you can see that hypnosis does more than calm. It also opens the possibilities of having different lenses on what is happening in their lives. And there's, I'm sure, a lot more about that. There's also a number of hypnotic techniques that I use for anxiety, and specifically, one of them is age progression or future focusing. Now, people with anxiety tend to have a temporal distortion. What I mean by that is that they live in the future, specifically what can go wrong in the future. However, you can utilize, as you said, David, utilize that skill and go into the future when things are better. I use that routinely with panic. It is now 9:54. You're experiencing a panic attack right now. Most of the time, panic attacks are over within about 20, 30 minutes. So what I'd like you to do right now is just imagine it's 10:54. And the intensity of the panic is gone. May not be all the way gone, but that feeling that your heart is beating so quickly and you're sweating and there's a sense of unreality, that has passed. So why not right now just go into an hour from now and feel that feeling of relief right now? You don't have to wait for an hour. Just pretend that you're feeling that relief now. Note I said pretend. And after a while, you may forget to remember that you're pretending and actually feeling a little bit optimistic. That feeling of, yeah, it's over. Wasn't fun, but I got through it. And you can also use fast forwarding to suggest that 6 months from now, you may still have a bit of anxiety, but I predict you won't be having panic attacks anymore. So you can have short-term fast forwarding and into quite a bit into the future, short-term future. And then we also use the opposite age regression. You got through that and you can get through this. You moved from one community. I know one of you moved from one community to another, and you got through that. And so perhaps you can get through whatever. So you use knowledge that you have, and we've all had experiences where we don't get to the age of 5 where we haven't had some ordeals and manage. So those are techniques that I use. I also use breathing in the light, imagining a rainbow and breathing in a particularly pleasant color and breathe into that part of the body that's feeling stressed right now. And just let it expand. Just let it expand. And then I say, and what are you noticing now? And almost always they feel a diminishment of anxiety. And again, if you look at my website, Carolyn Daitch, PhD, it says taming anxiety, managing anxiety, not getting rid of it. I think one question you had, and I know I'm going on and on, how did I get interested in this? How did I
Yes, and
get?
we have a habit here of asking that question seemingly in the reverse order. So, figured we were going to ask you that with like about 5 minutes left. So glad you're kind of ahead of the clock a little bit, which,
Mhm.
figures with time distortion. Yeah.
Yeah, we've only been talking 10 minutes, right? Um, uh, how did I get into well, most things in my life? I'm not that much of a planner. Was serendipitous. I was working in a clinic and I was in my imposter phase. I didn't know what I was doing. I was really young. I was like 29, and I really didn't know what I was doing. And I was being referred all these people with anxiety, and there weren't a lot of tools then. There weren't even that many good medications then. So I started making up tools. And a lot of those tools that I made up are in the affect regulation toolbox. Not to say nobody could have thought of the same tools, but I just was winging it a lot and seeing which worked. And but what the clients wanted from me, they wanted me to get rid of their anxiety now. Get rid of it now. And they were desperate to get better, and I was desperate to help them get better. That changed. That changed. I got humbled over the years. I learned over the years that the goal is not getting rid of anything, it's managing it. Whether it's anxiety um, or need for recognition or avoidance responses, you name it. It's about managing it and softening it so that we can live easier lives.
Yeah.
And so that's some way I've changed in terms of valuing anxiety and teaching people that I can pretty much reassure you there are going to be some changes. But I'm not going to change your temperament. I'm not going to change your biology. But everybody, this sounds very grandiose, but I say it anyway, because I think positive expectancy is really important. I can say to you, David, nobody I've worked nobody I've worked with didn't get better. That's up to you if you do the work or the play or the assignments, but everyone gets better. And what a good feeling the first session for people to notice that people do get better.
So I know we're close to the end, but I wanted to imagine I'm a listener out there somewhere and trying to look at the notes that I've taken. What are the main takeaways for me? I heard three things that you said that I think are worth repeating. One is movement, the second, flexibility, and the third, curiosity. If I can be curious about moving from my back to my toe, from myself to my partner's perspective, if I can show that movement from here to there and be flexible in my thinking, I'm going to come away with a managed anxious state, even if it's not entirely gone. And that, if I've got it right, is such a hope inducing message that you gave throughout our time together today.
What a good listener you are, David. You should be a psychologist. What a good listener. I feel very attuned to. And could I add two more things?
Please.
You can
Yeah,
add as many as you'd like.
that's
Two,
funny.
two other um, approaches that I think are mandatory in our lives, but particularly mandatory right now, is being in the moment. Like right now, as far as we know, David, you're okay. And Eric, you're okay, and I'm okay. We don't know what's going to happen 4 hours from now. But I like people to get into the moment. And that really mitigates about all the things that could be happening with nuclear testing or climate change or whatever, that in this moment we are okay. And I'd like you to take your thumb and your forefinger together and think to yourself, well, I actually say it aloud. In this moment, I'm okay. You can say it aloud.
Mm-hmm.
In this
In
moment,
this moment, I am okay.
Yeah.
in this moment, I'm okay. In this moment, I'm okay. And I am.
And I am.
And then the other one I'm throwing out there is it's really hard to be anxious if you're in a state of gratitude.
Mm-hmm. That's lovely. Yeah.
So if you find yourself anxious or you just find yourself alive, spend a few minutes connecting to what you're grateful for.
Yeah. Beautiful.
And that is the word of the day, isn't it? And
Yes.
And
that's what we keep hearing today is and.
Yes.
get away, get off the butt, metaphorically and literally, and say and.
Yes. Mm-hmm.
Mm-hmm.
Beautiful. That's great.
One thing I just wanted to highlight, I think, David, you hit so succinctly on the points. And I'm also just struck that one of the great problems of this interview is each time we try to summarize, Carolyn keeps delivering more gems. So a part of me has given up trying to do that. But one thing I wanted to highlight was the really deft way, Carolyn, that you worked with the tension for anxious people of feeling quote unquote reality based, right? The but, you want me to get better, but, and working with that, yet providing flexible, permissive possibilities of what could be. So there was a moment when you were giving a little example of how you would work with somebody, with a panic attack with using time. And you said perhaps you can pretend um, that you're at that moment an hour from now when you're feeling more relaxed or you're on the other end of the cycle. And then you said, and then maybe, and I don't remember if you said you can forget to remember or remember to forget that you're pretending, but that really caught my attention because I think what it highlighted is that what we imagine has the potential to become our reality.
Mm-hmm.
And that can be the case with anticipatory anxiety in the negative,
Mm-hmm.
but it can also be the case with treating anxiety and highlighting the positive.
Mm-hmm.
Yeah.
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 Exactly. Yeah. Maybe this is when we need to, unfortunately, say goodbye to Carolyn. I know you have a busy morning ahead of you. Do you need to get on with your morning?
Yeah. But this
Okay.
is so much fun, I don't want to.
Well, I'll just say this. First of all, my moment of gratitude to you. And I think it's more than just a moment. I continue to feel enriched, grateful for my connection with you, my relationship with you. You've offered our listeners a gift. As we started off, we said these are anxious times. I think you made reference in the beginning. The structure of our community is eroding. And without that structure, many people across the country, across the world are feeling anxious. And so, what you have sent out to the world from this podcast is a way of feeling okay now.
Now.
I am okay right now.
Right.
There's a
Yeah.
sense for optimism, there's a sense for hopefulness. And I can't think of a more profound and pervasive gift that you've given. And I'm so grateful for that. So, thank you.
Well, I am just honored and delighted that you invited me to come onto this podcast. And I really find it fun to be with both of you. I've missed you both.
The feeling is mutual, and it feels like the time has flown by since we last were together. And certainly the time has flown by as we've all been together today. It's just been so rewarding, echoing what David is saying about just profound gratitude. And I've certainly learned some tools that I can apply in my own life. So thank you for that too.
We need to walk our talks.
Exactly. So until we meet again, thank you, Carolyn Daitch, Dr. Carolyn Daitch. Thank you, Eric, for co-hosting again today. Stay tuned, folks. We have more interviews and conversations and helpful tips coming up. Thank all of you for tuning in. Until then, goodbye and take care.
And David, can I just add one quick thing before we go?
Yeah, go ahead.
As always, let us know your feedback. Transformingrelationships@gmail.com is the way to reach us. If you had reactions, comments, questions from the show today, we would be happy to share those on a future episode. And just to be clear, it's TRANCE, forming relationships, one word, @gmail.com. And we'll see you all next week.
Okay, take care.
Bye-bye. As always, thank you so much for tuning in. We look forward to catching up with you again in our next episode. A quick reminder, while we are both doctors of psychology, this podcast is not a substitute for professional medical advice, does not offer diagnoses, or engage you in actual treatment. The conversations, the opinions of our guests, and any information that we share here are meant for your general knowledge, your learning, your inspiration, and your motivation to put some of our ideas into practice in your day-to-day life. Remember that everybody's body and everybody's personal health journey is different, so what works for one person may not be right for the next or for you. If you have questions about your health, any psychological or medical condition, or any changes that you're thinking about making to your lifestyle, your diet, your exercise routine, your medications, or some other aspect of your life, it's always best to talk with a qualified healthcare professional who knows your personal history. Never ignore or delay professional advice because of something you heard here with us. We want you to enjoy the show and to walk away with useful insights, but ultimately, you are responsible for your own health decisions. Please use your best judgment, stay curious, and always listen to your body. Take care, be well,